All right, I want to go through a quick overview of the actions of the hip to help you group muscles and ultimately understand why these muscles perform that action. So first, flexion. Recall flexion would be pulling that thigh forward. So these muscles are iliopsoas, sartorius, and rectus femoris. So if you go back through both the lecture and the image sets, why would all three of these do this? Well, they cross the front of the hip. Something that must pull that thigh forward must cross the front of the hip. Extension then would be the opposite. So you have gluteus maximus, right? You'll have that's behind the hip, right? Then you also have the hamstring muscles. They're going to be located in the posterior thigh, but based upon their attachment proximally up near the hip, they pass behind as well. And so those would be the three hamstring muscles that cross the posterior hip. Okay. So again, if I cross the back of the hip, I can pull that thigh backwards, right? That's extension. Abduction, much like deltoid on the outside of the shoulder, could pull the arm out. Gluteus medius and minimus at the hip, because they're more lateral, can pull the thigh out. So can tensor fascia lata. Again, the ability to pull outward or to abduct is to cross the outside or lateral side of the hip. Adduction, that's to pull the thigh back in. Muscles can only pull, so they have to be on the inside of the hip, and the muscles that are inside of the hip are referred to as the medial thigh compartment. Now they're organized in two layers. Layer 1 is the gap, GAP, and layer 2 is adductor brevis and magnus. Recall that if you have a longus, you probably have a brevis deep to it. Okay, and these can perform adduction because they cross the inside of the hip. They're underneath the hip joint, if you will. Okay, they're medial to it. Medial rotation, lateral rotation, we don't teach you medial rotators. Okay, they would pull horizontally on the front of the femur, though, to be clear. Whereas lateral rotators have to pull from behind. So you're going to see a posterior muscle, right, gluteus maximus, and then deep to that you'll see piriformis. Both of them pull horizontally on the femur from posterior, so they can perform lateral rotation. This should remind you a bit of infraspinatus pulling from behind and teres minor pulling from behind. Those were lateral rotators of the shoulder. Now the knee should be pretty straightforward. It's extension and flexion. There's only one group of muscles that can straighten out your leg, quote unquote, straighten out your leg. That's the quadriceps group, rectus femoris, and the three vastus muscles, because they all pull from the anterior of the knee. One group of muscles acting on that patella, and then that patella follows. So does the tibia. Any other muscle that works at the knee is going to perform flexion. Okay, so you're going to have muscles that pass behind the knee from the thigh, and then you also have muscles from the leg, a muscle from the leg that we study, pull from posterior, passing behind the knee. From the thigh, you have the hamstrings again, so that tells you they're behind the hip and behind the knee. Sartorius is an odd one. It starts off in the front, but by the time it gets to the knee, it's behind it, posterior. So it has to wrap around the thigh to get to the back of the knee. You'll see that in an image. And gracilis, it's a medial thigh muscle, but by the time it gets to the knee, it does passes posterior to the knee. Gastrocnemius is your calf muscle in the back of your leg. That crosses the back of the knee, so it can help with flexion. Again, big picture, group these muscles up based upon how they relate to the joint. Visually, this helps you, right? But contextually for the lecture exam, it should help you as well. And now for the ankle and foot. Keep in mind for the ankle and foot, we do not have extension and flexion at the ankle. What you have is dorsiflexion and plantar flexion. So dorsiflexion means to pull that foot up. Okay, so you're bringing the entire foot up, all right? In order to do that, a muscle must cross the anterior ankle, right? It needs to cross in front of the ankle on the way down to the foot and or the toes. And so keep in mind that none of the muscles are going to have dorsiflexor in the name. The muscles are named for something else. So fibularis tertius is named because it's next to the fibula, in front of the fibula. Tibialis anterior is named because it's in front of the tibia. And then extensor hallucis longus, EHL, and extensor digitorum longus, EDL, are named for what they're going to do when they finally reach the top of the toes. They're going to extend them. They're going to straighten those toes out. But again, we don't have extension at the ankle. We're talking about the ankle and foot here. Because these cross the front of the ankle on the way to the tops of those toes, they will help with dorsiflexion. The acronym for the dorsiflexors that cross the front of the ankle, which are also the anterior leg muscles, is FEET, F-E-E-T. Plantar flexors must cross from behind. So you have gastrocnemius and soleus. Those are two good calf muscles that are superficial. And then you have the deep group, Tom, Dick, and Harry, tibialis posterior. That tells you where it's at. Doesn't tell you that it plantar flexes. What tells you that it plantar flexes is that it's behind the ankle. Okay? Tibialis posterior, flexor digitorum longus, and flexor hallucis longus. So again, keep in mind that when we name anything digitorum or anything hallucis, if we name it flexor, that's because it's flexing the digits or flexing the big toe. If we name it extensor hallucis, it's because it's extending the big toe, right? Or extending the digits for extensor digitorum. It is not named for what it's going to do to the ankle. Collectively, try and make this as straightforward as possible. Anything that's behind the ankle, plantar flexes. Anything that's in front of the ankle, dorsiflexes. Okay? And the name should hint as to which of those is true. For example, tibialis posterior or tibialis anterior, that type of thing. They can be really good clues. Inversion, you have to remind yourself of what the medial bone of the leg is. That's the tibia. Versus eversion, you have to remind yourself what the lateral bone of the leg is. That is the fibula. Okay? And so a muscle that's next to the tibia bone is going to have tibialis in the name. It's perfect, right? Tibialis anterior, tibialis posterior. When those two muscles, one might be in front of the tibia, one might be behind the tibia, but when they cross the foot, they're crossing on the inside. So when they pull, it's like pulling the inside of your foot up. That's inversion. Eversion, notice all of them have fibularis in the name because they're on the outside, adjacent to the fibula. Fibularis longus. Deep to that would be fibularis brevis. Both of those actually pass behind the fibula. If I were to rename them, I would rename them fibularis posterior longus and brevis, but we can't rename things. And then the one in front, or the third one, would be fibularis tertius.